Well, let's talk about the ecosystem and the healthcare system,
Mhm.
because I think you just pointed out when the pandemic hits, these people are hit really, really hard. And yet, if I'm wealthy, I can get concierge and pay extra money, and I can have a doctor, I can call them up and get in. So, can you talk about kind of the healthcare landscape and just how it's tilted kind of in an unfair fashion, I guess?
It it is, and I believe the Affordable Care Act was an attempt to mitigate that, to make it a little bit more even. The tough part about it, as we're talking about our healthcare landscape, is that the some of the healthcare systems, I won't name doctors specifically, couldn't afford to bring lots of folks with CMS products, so Medicaid, Medicare, and so forth, because the reimbursed rates are so low. So, in order to keep their institution viable and sustainable, they need more private payer folks. So, I won't name them all, but the ones that pay better reimbursed rates. And so, what it gave you was some healthcare insurance, so you could get a prescription filled. You could get scheduled for a procedure or an appointment, but it didn't mean it put you at the front of the line. A lot of times it meant you were waiting weeks or months to get in to see the docs, right? And so it is skewed. It's like most things in society, haves and have nots. And the haves have most, and those who don't have the least. And they're the ones that often suffer. And you didn't ask me how to fix it, but it's the title of my book. Take care of them like my own. And if it's good enough for your spouse, for your child, for someone you care about, then it should be good enough for the person sitting in front of you.